My initial symptoms were a lot of pain, like in my lower back. I really had problems sleeping, and in the morning it was really awful stiff, and my flexibility had become totally restricted. Like bending over, if I dropped something on the floor, it was a joke. Because my mom is 80, and we would drop something together, we both look at each other like, okay, who's gonna pick that up? And she'd be like, now wait a minute, I'm your mother, you know, you need to pick that up. And I'm like, well, mine hurts, you know, so. And he had some problems cervically, pains going down his arm. So she had made a copy of the flyer from the lady and gave it to him, and he thought about me because, I mean, he knew what had happened to me. So he brought it to my office and was like, I got something that I want you to see. And I was like, okay. And how ironic, I had an appointment scheduled for the following Thursday to see a surgeon. Yeah.
No kidding.
Yeah. What didn't I do? I had seen a chiropractor until I basically exhausted that, and they get me to a point where I would feel better and then I would tank, and I couldn't get any better. So then after the MRI, then I went to physical therapy. Physical therapy was going okay, and then whatever we were doing there started putting pressure on my sciatica, and the pains were starting to shoot down my leg, and basically the physical therapist was like, this isn't something that I can help you with. You're gonna need to go back to the doctor. So then I did shots. So I had, I think, 3 of the spinal blocks. And it was to the point, I went and saw a surgeon actually last December, and then I talked myself out of it. But over the summer, I was just kind of like, I gotta do something, I gotta do something. I don't know what I'm gonna do. I don't want surgery, but I gotta do something, because I had to make sure I got contractors, you know, to take care of grass, to shovel the snow, you know. I mean, it just got to where I was becoming more and more debilitated. When I first came, Dr. Boot, you know, did the assessment and basically told me how because I know that my pain was more left side justified, how I was losing strength, like in my left foot and my left leg, which I can really kind of tell because I do work out, and when we do stuff like one-legged, you know, I have a hard time balancing myself on that leg. And so basically they just started with like some muscle. You always get like the muscles, they wake up the blood flow before you get on the table, and then the stretches. And the first day I was a little throbby after the treatment, but by the end of because I did 4 the first week, and after that first week I actually could feel that relief. It was like, because the diagnosis was spinal stenosis, and basically that's the narrowing of your spine. So that restrictiveness that I was feeling, like trying to bend over or stretching or anything like that, it was alleviated. And, you know, that was just like, wow, okay, because I was doing a belly dancing class for a while, and the main thing with that is doing figure 8s with your hips, and it would hurt so bad. But I would still do it because I know that's how I am. I go hard, go home. And now, you know, every morning I get up and I'll do my little figure 8, and I'll go, okay, so yeah, I can still do that, and it doesn't hurt. So that's exciting. There was lots of apprehensions. I mean, because I had gone down all these other roads, you know, I'm kind of like, okay, yeah, everybody's going to tell me they can help me, and I'm going to get to this point, and then they're going to be like, oh, well, I can't help you anymore. I don't know what to tell you, kind of blah, blah, blah. So, I mean, I was apprehensive. The tables were different, you know, for me. So basically over that weekend, I kind of started doing a lot of research, you know, Googling it, you know, does it work? What's it about? And I didn't have anything to lose, though. You got to realize I had nothing to lose but for somebody to cut on my back. And the more ironic part about this is because I work at a hospital and I called my insurance, they would not cover it. But they would cover for me to have surgery and be off 4 to 6 weeks on FMLA for me to try to do something that's non-invasive like that so I can continue to work. So I just find that totally mind-blowing, and I think unfortunately until the insurance companies and the hospitals get on the same page, they'll still just kind of look at this as, you know, something that works for some people and not for others. But they're quick to send you to a surgeon now. Well, I did the 4-4-4, and then we had the holiday week, so I only did 2 last week, and then so far I've done 3 this week. You feel like somebody actually went in there and took something that was blocking your flexibility and your mobility and movement out of your back and took it out, but without cutting on you. Without surgery, without rehab, without all of that. Without being off work, which they should be happy about. So yeah, I mean, it's just one of those things where you come here and you feel better when you leave. Like, I mean, I had some inflammation this morning, probably because I was jumping rope with my nieces over the weekend. But I mean, get off the table, put some ice on it, I feel good. And I get back to work, I don't even think about it. The rest of the day, you'd be like, all right, see, you forget. And that's the thing. It's been almost 2 years and I could not ever forget. I never got to a point where I could forget until I started coming here. And it's so funny because over Thanksgiving, my mom was there. And, you know, I'm cooking and I'm, you know, going around the kitchen. If I dropped something, I would just pick it up and she'd be like, you didn't think about it. I said, I know it's kind of scary because I had to get used to the fact that I didn't have to hesitate anymore before I would go and move. Because I always expect, you know, you're going to feel that pain, but you got to do it anyway. And so you get to the point where you would hesitate before you did it because I knew it was going to hurt. So, you know, now I'm getting to the point though where I can go like, you know, you just forget. And that's the greatest feeling in the world, is to not have pain in your back.